Hello, Dr. Melissa Boylan here from Noretta Family Medicine. I'm going to talk today about the Delta variant in COVID-19 vaccines because I'm still hearing some hesitation about getting the COVID-19 vaccine and also some misinformation about the Delta variant. So I thought I wanted to try and do a video to try and clear up some of this confusion. I think that the reason there is some confusion is because people are getting their information, their news from a lot of different sources, and these sources are not necessarily vetted. Whether they're even giving the right information can sometimes be in question. And a lot of other news sites tend to sensationalize things to help to grab people's attention. So they take things out of context, quotes out of context, stats out of context, and helps to create an environment of fear. So what I want to try and do is remove the fear and just give you some facts. So the first thing that I want to talk about is what a variant of a virus is. So what happens is that a virus's number one goal is to survive, much like our goal is to survive from day to day. So what happens is when the virus is replicating inside of somebody, sometimes there will be some offshoots, some mistakes that are made whenever it's being copied and replicated. And most of these variants, these are what are called variants, don't end up going anywhere or causing any problems. But occasionally there is a variant that does do something good for the virus. And something good for the virus means that it helps it survive. So with the Delta variant, it is more contagious, and that's why it has caught on around the world and in this country. So the chances of you, if you unfortunately get the COVID-19 virus today, it is a very high likelihood that you will have the Delta variant, just because it's more contagious. Let's talk about what the variant actually is. So you can kind of think about it like this. If I am going outside and it is cold outside, I'm going to put a winter coat on, okay, to help protect me from the environment. If it warms up outside in that environment, then I'm going to take that coat off. But I'm still the one that's there. I'm still the one that was wearing that coat. It's just that I've changed. I've adapted to my change, the change in the environment that's out there. And so that's basically what happens with these variants. It's still COVID-19, but it's just a slight tweak to the virus itself. The good news with these variants is that they are still, is that the vaccines that are out there are still protecting us against the variants. They might not be quite as good, okay, but they're still very good. Still very, very good at protecting us. So just know that. But we do know that there are some people that have been fully vaccinated that have gotten sick with COVID. And so these are what are called breakthrough cases. I kind of, as another analogy here, I think of breakthrough cases in fully vaccinated people, similar to injuries in people that are wearing seatbelts, okay, but getting into a car accident. Wearing a seatbelt certainly protects you against very serious injuries and other things, but it's not 100% effective. And same thing with these vaccines. The vaccines provide you some protection, but they're not going to protect you against 100% of all possibilities of infection. And so I guess I wasn't surprised when I started to hear about breakthrough cases and some states reinstating the mask mandates. It wasn't really a surprise to me. Just a brief aside about masks, we know that masks work. Some masks are certainly much more effective than others. We know triple layer surgical masks, those types of things are much more effective than a single layer mask or a mask that's worn below the nose, whatever. But if you can kind of just think about how a mask works, for a respiratory virus, we are breathing out the virus if we're infected. And so if we have something there, a barrier that captures some, if not all, of what we're breathing out, all of those particles, then that's going to help protect us and protect, frankly, other people from becoming infected when we're talking, when we're breathing, when we're coughing, those types of things. Masks are nowhere near as effective as getting a vaccine, though. So I don't want you to think that if you can, that if you wear a mask, then you're going to be completely protected against getting infected or spreading the infection to others. I don't know. I think there's a bit of a trust issue right now, that's out there with the medical field, and I think it is because of a lot of these statements being misconstrued, and there are recommendations that are being changed, and so that creates mistrust. But the truth is that science is always changing. Our knowledge base with science is always changing. And so, yes, there will be times whenever recommendations change. And that's just part of it. That's part of being a doctor. I have to accept that as well. If you have concerns or questions, please reach out to me, reach out to your doctor if I am not your doctor, and please get some answers to your questions. There's a lack of trust right now between, what the government is saying or what politicians are saying and the general public. And I want to try and bridge that gap. As somebody that has skin in the game with both you, I want to try and keep you healthy and happy. But I also have some knowledge in order to interpret medical literature. So it's not as easy as you might think. And in fact, it's very difficult sometimes to interpret medical literature with all the statistics that are out there and tests that you can do. So if you have any questions, don't hesitate to reach out to me. I'm happy to talk to anybody, or you can leave your questions here below this video. Email me, whatever you need to do to get in touch with me. But I wish you the best and take care.